We all want our children to live life to the fullest. For children with autism, it can be a challenge. With a new case diagnosed nearly every 20 minutes, autism touches more families than ever before. It's the fastest growing developmental disability in the country, more common than pediatric cancer, diabetes, and AIDS combined. As the demand for autism services grows, the Center for Autism at the Children's Institute is quickly becoming a center of excellence in our region and beyond. In the day school, the Sheila and Milton Fine classrooms for students with autism are specially designed to create an environment where children receive the individualized education and care that helps them achieve amazing things every day.
You have to take each child as they come into your classroom, evaluate the child, see what their needs are. Being that it's a spectrum disorder, there is a wide range of behaviors and different issues you have to deal with.
I think the most surprising thing is how happy the staff is and how compassionate, and they have passion for what they do. This school is filled with love and kindness. I don't know where our family would be without this facility.
Research has shown that both light and sound have a great effect on children with autism.
Each of the classrooms that we have in our program have been equipped with special lighting. We have taken out all of the fluorescent lighting, as well as putting in sound limiting tiles into the rooms so that there are not echoes and loud sounds in the classrooms, since we do tend to have a lot of noise at times within the classrooms, just between the kids and the movement that goes on. So it helps to reduce some of those distractions for the students to make them feel more comfortable and safe.
With autism on the rise, more and more families need somewhere to turn. Fortunately, the Children's Institute is one step ahead of the epidemic. Dr. Scott Faber, a developmental pediatrician at the hospital at the Children's Institute, works closely with children with severe developmental and behavioral disorders, including autism. Dr. Faber and his team are using integrative approaches to treat this disorder, as well as studying the possible causes of autism.
So what we're really looking at here is an attempt to study what is the origin of autism, and what we'd like to do is look at this from a clinical point of view, and we're hopeful to get at least some degree of basic science research working with us and an entire clinical plan of treatment. How we work with children right now is we make sure that they get all of their standard care, in other words, great educational services, something called wraparound, which is well known. So the system that we're doing is straightforward and fits in a very integrated manner with what other pediatricians and psychologists and educators are doing.
The care administered by Dr. Faber and his staff at the Children's Institute is anything but standard. Combining medical expertise with genuine concern and devotion to his patients is what makes Dr. Faber's approach to autism so unique.
Dr. Faber is such a pioneer. There are some other places that will make the diagnosis, but he is the one that says, and what are the roadblocks? What is going on within this child that's not balanced, what is dysregulated, what are some how can we just get this child to the best that he or she can be? What roadblocks can we remove, and what is the simplest, he's a biomedical person, way we can do it without harming the child.
The Ritchie family began visiting Dr. Faber in 2005 when both of their daughters, 7-year-old Lindsay and 5-year-old Natalie, began showing signs of autism.
When we first learned that our first daughter had autism, and then, of course, later that our second daughter also had autism, we were, of course, crushed. You feel very low. You feel lost. You aren't really sure what to do or who to turn to, or how do you get help for autism? Nobody really knows that. We were also a little bit relieved because we knew what was wrong with them. And so there was a little bit of relief within all of that confusion. And that's, after that, that's really why the Children's Institute was so important to us, because they answered all of those questions that had us confused early on after the initial diagnosis. The thing that surprised me most about Dr. Faber was how much time he took with us to explain what was going on with our children and how to treat them. And he didn't just shuffle us through the system. We didn't feel like we were being processed by some medical facility. And he really took the time to help us understand what was going on and what we needed to do to help our children.
The changes we have seen since we've been visiting the Children's Institute are nothing short of miraculous. In 2005, when we started seeing Dr. Faber, my oldest daughter had 2-word sentences. We couldn't go to the Giant Eagle for a gallon of milk. We couldn't hold her, we couldn't touch her. 8 weeks after seeing Dr. Faber and doing what he asked us to do, my daughter looked at me for the first time and said, "I love you, Mama." And for my little one, when we started working with Dr. Faber for her, she just became a pleasant person and someone who just wanted to be hugged and loved. And we are a family, and it's not that we weren't a family before, but my daughters can tell me what they feel, why they feel it. They look me straight in the eye. They tell their dad they love him. They tell me they love me. They're going to typical school, and 3 years ago we didn't even think that was going to be possible. But our family, who's been with us since the beginning, and our friends know exactly what we've been through and what the Children's Institute and Dr. Faber have done to help us get our girls back.
You know, there are so many children. You know, we need to clone Dr. Faber ×4. I don't know how that would be possible. You know, we have huge waiting lists to see him. We need it to expand and grow. We need more services. We need more staff so that we can help all these children. But ideally, it would be, you know, let's find really what's doing it. Let's make it so we don't have all the children suffering with this condition. And it's not just the child, it's a family disease. I get so many calls every day. This is such a journey. We will walk with you on this journey. We will support you. You know, we will be here for you whenever you call so that, you know, we can just try and make things better for you and the entire family. And sometimes just having someone that you know you can trust, you know you can turn to, can be a gift.
I went through a period of why us, and I think the answer was why not you? What makes you so special? People know that, you know, people who are close to my husband and I, they know us, and we're not perfect people, and I think if we can do it, and we've had support from friends and family, we feel obligated to help other people do it too. We've had spectacular results, but no matter what would have happened, they are my girls, and they deserve the best, and they'll get the best so that they can be all that they are supposed to be.